At first, it's terrifying because I was aware of how afraid I was, but I didn't know of what. And at the same time, after the fact, realizing, okay, now I see how all this puzzle fits together. And it wasn't me. That wasn't this is a result of what had happened to me. And then there's a cycle of disbelief and sadness and anger. There's a whole bunch of things that come up because this was something that happened with my mother. And also it involved a pediatrician. There were separate incidents. So there's a whole cycle thing, but going into it, it's as if someone is holding you by the hair saying, open your eyes, you have to look, and you're scared to death to look. But then when you look, in air quotes, and you finally are able to face these things and understand what happened when you were 5 or 6 years old, that in and of itself is a sense of profound and absolute relief.
Welcome to Therapist Uncensored. Building on decades of professional experience, this podcast tackles neurobiology, modern attachment, and more in an honest way that's helpful in healing humans. Your session begins now with Dr. Ann Kelly and Sue Marriott.
Hey everyone, this is Ann. Thanks for joining us. I have two people in our online studio that I'm really excited to talk to. They have written a book together, they're co-authors, entitled Every Memory Deserves Respect. And the reason I'm going to start with the concept of the book, we don't always do that. I found this book very, very usable. This book is written to help those out there really understand EMDR. We had Laura Parnell on our show to talk about attachment at EMDR. Awesome dialogue. Really encourage you to go back and listen to that if you haven't already. But I found this book so usable for those out there that are going, what is EMDR? Why would I want it? So I'm really excited to have these two on the show. So I'm here with Michael Baldwin and Dr. Deborah Korn. Deborah, do you go by Debbie or Deborah?
Debbie is fine.
Okay. So I'm really happy to have the two of you on the show. And Michael, I was going to toss to you to begin with because it was your idea to do the book. Would you mind jumping in and just saying what was the inspiration? Because I think that's what really matters here.
I was in EMDR treatment with Dr. Jeffrey Magdivita. And so your audience is clear. Debbie was not my therapist. Debbie is my co-author. And as I started to learn over the course of that 2-year period about concepts relating to EMDR and about trauma, I started to visualize images that I thought might help other people understand these concepts immediately, irrespective of age or culture or where they lived in the world. And so I figured that it took me a while to understand a lot of them, but what if I could come up with a visual shorthand way of doing it? So this device came to be known as what we now refer to as a billboard, where there's an image on the right, very little text on the left. And I showed about 6 of these to Dr. Magdivita about 6 months into my treatment with him. And he said, this could be a book. All you have to do is find an EMDR expert who's willing to co-author a book with you, who's never heard of you or has never met you and knows nothing about you. And in the end, that person ended up being Debbie Korn, who's on the call with us and who's my co-author. And by the way, when I took it to the publisher, all I showed them was about 6 of these billboards and a little synopsis of the intention of the book. I didn't have a table of contents or a sample chapter. I didn't have a co-author yet, and they were immediately interested.
How did you come to understand EMDR and have a desire to write this book?
It's because I spent about 22 years myself with 7 different non-EMDR therapists trying to get some kind of lasting or substantive relief or answers for myself. When I finally encountered Dr. Magdivita, when I finally was exposed to EMDR therapy, and I had the results that I was getting, I said, well, if I didn't know anything about EMDR and I didn't know anything about trauma, I bet there's a lot of people out there in the world like myself who are suffering and don't even know why, who are miserable and don't know why, who can't keep a job and don't know why, who keep getting divorced and don't know why. So I thought, why not try to create a book that decodes trauma and decodes EMDR, which Debbie always says is the most efficient and effective therapy when it comes to PTSD and trauma. Why not try to create a book that is truly accessible for the non-clinical audience? That was the goal.
I love that. And so you went for many years not really recognizing that the difficulty you were having in life was related to trauma. And in reading the book, I was really touched by and think about many people out there that are very high achievers. On the surface, they look like they have everything together. And you describe yourself as this very high-powered executive, on the move, traveling, running companies. And yet underneath, there were all these things that you were hiding that wasn't going well for you. Could you tell us a little bit about that?
Yeah, I was kind of a poster boy for what you just described because my chosen field was advertising, which is really kind of a, I don't know, looking back, kind of a status-obsessed, kind of glitzy sort of profession. But for me, it starts back with my own trauma story, which is really about neglect and abuse, both sexual, emotional, and physical abuse. So that was my background and my history, but I didn't know it as an adult. What happens for me was just the conditions of my, very early life became so unbearable that I started to develop sort of kind of an alternate personality and a strategy to help fight against a belief that I was worthless. That's why I was unlovable. So my strategy was a grandiosity strategy, which had to do with status and achievement. So I became a status and achievement junkie as an adult. To the description you were giving earlier, at the apex, I was, the worldwide account director on the IBM global business, had an advertising agency called Ogilvy and Mather in their New York flagship office. I had all the trappings that you would imagine. And the irony was that anything that would suggest that I was, failing at my job or did something wrong would send me over a cliff of I'm a failure. I'm gonna be found out. I'm gonna be the guy in front of the Walgreens with a blanket over him. I'll be penniless. I'm no good. It would just go like a black hole into that core belief that I'm unlovable and worthless. So it was all of this facade was really based on nothing having to do with my core authentic self. It was all surface, all superficial, all sort of window dressing for a completely opposite state of internal life, most of which I was unaware of, that was actually going on.
I think a lot of listeners out there could really relate to you in this, either in their own personal lives or with those people that they know. When you're saying the facade of grandiosity, the facade of, you mentioned at one point in the book, just the feeling of needing to have one more achievement, with how easily you might go down, and then be focused on achievement to keep the grandiosity up in order not to feel the underlying worthlessness. And it's not always easy to recognize, is that right? The feeling of worthlessness is right there. As you were going along, were you in touch with the feeling of worthlessness, or is it something that you were able to keep really, really suppressed from yourself?
I think it was very much suppressed. The way I would characterize the way I was living was just compelled to achievement, compelled to status. And looking back, I would go beyond saying I was focused on it to I was completely obsessed with it. There was no limit, no detail too small that I wasn't pursuing to embellish this image, this facade of super successful, everything perfect, and anything and everything I did. I look back at that person now and I'm half embarrassed and I don't recognize that person. But the thing to keep in mind is when you are in a survival strategy to mitigate against a feeling that you are unlovable and worthless, you have to pursue that strategy. And in my case, that was this constant but ephemeral need, run the Boston Marathon, but don't walk a step. Get into medical school, but don't go. Get a job in 13 days at the best advertising agency in Boston. Get promoted in 8 months, which has never been done before. Run the biggest piece of advertising in the world, IBM. But there was never any. It didn't ever sustain me. It was a constant kind of treadmill.
That's really, really painful. And how did you start to recognize that you were on the treadmill? If you're just compelled and compelled, what happened in your life that you started going, something's off, because society really pushes this, right? Society pushes that this is what's successful. You're doing exactly what you need to be doing. So you're not exactly supported by society to say, hey, Michael, something's off, right? It's like, there's Michael, incredibly successful. Respect him. How did you know something was off?
It's funny. This reminds me of a famous quote by Mike Tyson, and he says, everybody has a strategy until you get punched in the mouth. Me getting punched in the mouth was being laid off from my job, and it's different from being fired, but you're still not with the company. And I had wanted to work at this company, Ogilvy and Mather, my whole advertising career. This is like the Mount Olympus of advertising. And when I got laid off, the wheels just came off completely. My high-paying, high-status job was gone. So what was I left with? I was left with nightmares that had plagued me for decades, the same two nightmares I had that were never any less terrifying the first time I had them from the most recent time I had them, with phobias that I didn't understand that were phobias at the time. I just figured out, well, this must just, the fact that I couldn't use a public restroom, that just be me the way I am. Any suggestion of intimacy with a woman was completely panic-inducing. I guess that's just the way I am. So I didn't understand these as phobias. Not being able to form really deep relationships with people. So there was no distraction. The distraction of the 24/7 workaholic status treadmill was gone. So then I started kind of in a race to the bottom. And when I got to the bottom of that part in my life, fortunately, my sister suggested Dr. Magdavita, who was 110 miles away from where I live. And she said, what difference does that make? Are you serious or not? And so I would start seeing him.
And you had seen multiple therapists along the way that had...
7 over 22 years.
Over 22 years.
None of them who had ever mentioned or talked to me about trauma. None of them were EMDR therapists, knew anything about it or even mentioned it. The very first person that in the very first time I saw him started with trauma and then said, I'd like to work with you with EMDR the very first time I saw him.
Wow. He recognized the signs almost immediately. What was that like for you?
It was, thank God. I use a kind of a funny way to describe this to people, but, from an emotional standpoint, I was like crowning. When I walked in his office, I was so in a nadir, at a low point. I think he could recognize that. And I think he also recognized, based on my experience, that he could start this with me, which he did, because, the first time I saw him, we engaged in EMDR for the first time I had ever experienced it. But the sense of relief was so unbelievable. I remember driving back home to New York that first time I'd seen him. It felt like I had about 3 quarts of lung capacity more than I did when I went in to see him that morning. It was incredible. Every time I saw him, same thing.
I'm so glad you had that experience and that you thought then that more people needed to hear about it. Let's bring Debbie, Dr. Korn, into this dialogue because you were not his therapist, but this is not unfamiliar to you. Somebody coming to you with a history like this, it would be so easy as a therapist to miss the underlying trauma, wouldn't it? To go, oh, of course you're in this bad place because you just had this loss. Let's give you a pep talk and get you back out there again. But yet, those of you that really, really focus on trauma, you can see the insight and you could see what's going on for him. So talk to us a little bit from a therapist perspective, what it'd be like to sit with Michael and to help him move into the idea that it could be underlying trauma and EMDR would be helpful.
Well, most people don't show up for therapy and say, I'm here to work on my trauma from age 5 or age 10. Sometimes people do. Sometimes people come in with a real intention to address their trauma history. But most of the time people come in crisis or in despair, full of anxiety, having trouble in their marriage, having trouble at work. And it really is the job of an EMDR therapist, of a trauma therapist, of any therapist for that matter, to begin to get curious and connect the dots collaboratively with the client. And so, if Michael were to come in to me and tell this story of crashing in the face of being laid off, we would quickly move into the recent experience, kind of vivifying this recent experience of, when this happened, walk me into it. What did you feel? What were you thinking? What were you experiencing in your body? And from there, once we've activated the recent feelings and experience, we invite the client to float back, to follow that experience back over time. And we might do that through direct questions. Have you ever felt like this before? Or when did you first receive messages like this? Or when's the first time you remember thinking, I'm a failure? Or we track it back via the body. I might ask Michael to say, okay, as you think about being laid off and all the feelings and thoughts and sensations that come up with it, just follow that back. Close your eyes, focus on it, and follow it back. And let your mind and your body take you back to earlier times where you felt something similar. And sometimes people go back a few weeks, some people go back a year or years, and some people go back with our help, with our encouragement, to early childhood. And we start to identify significant life experiences that link into the themes, to the sensations, thoughts, feelings, symptoms that we're seeing in the present. And we begin to identify these experiences as targets for EMDR.
What do you attribute the relief that Michael is talking about from the very first session? And Michael, feel free to jump into here. You for years and years and years, you've been to therapists and you haven't left with this kind of relief. Yet after a session, and that's my experience too from clients that I refer on. I am not an EMDR therapist, but we refer individuals to EMDR and they will describe the immediate relief. Can you talk a little bit about what that's about?
Well, I think perhaps for the first time in any of his therapy experiences, Michael dropped down from his mind, from his words, from his thinking self into his emotional self, into his body-based self. And Dr. Magnavita brought him into his experience and supported him in staying there, in observing. In EMDR, we talk about the importance of dual attention, which is staying grounded in the present, firmly connected to the therapeutic relationship, and observing, noticing from safety what is emerging within oneself. And so for the first time, Michael had real support and holding to stay present and to observe, to slow down and observe, and to begin to identify what would emerge as he paid attention internally. And as those earlier experiences came forward through EMDR processing, he was able to process experiences, pre-verbal, nonverbal experiences that he'd never been able to access before. So there were incredibly intense somatic experiences that emerged that I think went back to early pre-verbal times where he was severely neglected, alone, hungry. There were times where he felt overwhelmed and terrified when he was being bullied by his brother, when he was left alone to fend for himself at school with a bully. So he was able to access the components of those experiences that had never been brought into treatment previously. And it's not to say that previous therapists hadn't perhaps explored that territory with him, but whatever that special sauce is in EMDR that helps people to access and to process to resolution the material that is frozen or locked in their nervous system, this time he was able to do it and stay with it until he was able to get full relief.
And from my point of view, if you want some imagery, I remember that very first session, it was as if a big oil reserve, one of those big things that we pass on the freeway, those huge big tanks, had the word neglect on it. And as if Dr. Magnavita poked a hole in the side of that reservoir, and just feelings just started pouring out. And that is not intellectualization. It's not me talking about them. It's me feeling these feelings of longing and loneliness and yearning and fear of being abandoned, all those things completely viscerally for the first time. Because when we started, it was really starting with getting a handle on the impact of that sustained neglect, which then turned into abuse and things that I wasn't even aware was there.
So you really resonate with what Debbie's talking about in terms of just the flood and getting in touch with the feeling. Like it was able, and I'm sure spending a lifetime, which you mentioned in the intellectual and the grandiosity, that the idea of pricking the emotional part and letting it flood, was that scary to you? Was there any part of you getting it? Because I know sometimes people that haven't accessed their emotions, it's terrifying.
Part of what I would say was it was surprising, like something creeping up on you, like all of a sudden this stuff's just coming out of you. So it was more of a surprise at the depth and the intensity of the emotions, because in my case, it was a lot of kind of convulsive crying. It's anything but what talk therapy was like for me. It wasn't terrifying, but it's like when you feel the current of an ocean in a really strong wave and it picks you up and takes you someplace. It was kind of like that. Like, whoa, I mean, I'm not in control of this. This is just going to now happen. He punched a hole and now it's just going to come out.
I just wanted to comment that, for many clients entering therapy and starting to work on their traumatic life experiences, it is quite terrifying. They're afraid of what they're going to remember. They're afraid of whether they can tolerate it. They're afraid of whether they're going to get worse rather than get better. They are thrown into conflict about realizing things about people who are supposed to care for them but hurt them instead. And so in EMDR therapy, we definitely spend time up front in the preparation phase of treatment, getting folks ready to confront strong emotion, getting them ready to maintain that dual attention in the face of emerging experiences. And then moment to moment in the EMDR treatment, the therapist is very active at the client's side, reminding the client it's old stuff. Just be an observer, just be a witness. You're not alone this time. I'm right here with you. I'm at your side, right? You're safe now. So we work very hard to make sure that folks are observing and noticing, not reliving. It's about redoing, observing and being able to redo. Think about what they would have liked to have happen, what they would have liked to have said, what didn't happen that needed to happen. We address that and process that. But it's not about lingering in that state of profound and utter aloneness and pain. As an EMDR therapist, part of my job is keeping it moving, making sure, as the train moves down the tracks, we're clearing the debris off the tracks so the processing can keep moving toward resolution, toward relief.
Also, I think Debbie makes a very good point there. One of the indispensable aspects of this equation, client and therapist, clinician and patient or client, is being reassured by Dr. Magdivita that he was there with me. This is now he can't hurt you anymore. You're safe now. The absolute certainty that I had that all of those things were true with him in that office. And I think that's what allows this process to really fully take place, because for the first time, I had someone there as my champion who was not going to abandon me. And oftentimes, by the way, he would take my hand, because he could see what terrible distress I was in. And he would say, listen, Michael, take my hand. You're safe. It can't happen now. You're going to be fine. So for me, at least, that was one of the big reasons why this level of exploration and release and redoing was possible.
I really appreciate y'all describing the difference for our listeners in reliving versus redoing, because there is oftentimes people like, why would I want to relive that? How can that help me? It was a horrible experience, or I've put that out of my mind. I don't want to revisit that again. Why would I go through that pain? And for really moving it through your body from the unfrozen part, the redoing is the most significant part of moving that to an experience that gets integrated. To that, it seems like that's part of the relief you were leaving. All of a sudden, this part that you'd suppressed so long was becoming integrated as part of who you are. And in this very safe reliving way, instead of being alone, You were right there with somebody. The trauma of being alone in neglect and in abuse, that's what is the fear-based stuck frozen spot.
Yes. Yes. When I think about redoing and the opportunities for repair through EMDR therapy, I think of two aspects. The first is giving folks a chance to express or do what they couldn't do at the time. So they weren't able to run or flee. They weren't able to speak. They weren't able to fight. They weren't able to reach out for help. There was no one there. And so in EMDR, when we notice that there's activity in the client's body, when we see that there's words on their lips, we encourage and support. Go ahead and say what you couldn't say back then. Go ahead and imagine doing what you couldn't do back then. So that's a form of redoing that brings tremendous relief for people. And also there's an opportunity to redo in terms of developmental repair, where we invite the adult client, the adult self, to imagine going to the younger self and offering nurturance. I'm sure you probably heard about this as you talked with Laurel Parnell. There's real opportunities to bring nurturance inside, to bring understanding, to bring validation. So it's almost like this parallel process where the therapist is offering validation and care and understanding and cheerleading and all of that to the client, the adult client sitting across from them. And then the adult client is going inside and imagining bringing that kind of care to the parts of themselves that are carrying these attachment wounds, these trauma-based beliefs and feelings. So that's a chance for redoing as well. And Michael actually tells I love your yoga story.
Yeah, I before COVID, I would go to hot yoga every Friday. And at the end of yoga, it's, Shavasana, which is corpse pose. And this notion of what Debbie's just talking about was one of the ones where it just took me a long time to understand what it meant. And when I finally got it, there's a billboard in the book about it, I would take that 5 minutes or 7 minutes of Shavasana at the end of yoga to imagine myself with my eyes closed, and the younger versions of me would be maybe a 2-year-old version of me. Here's a 2-year-old version of me would come out, sort of peek out from behind a rock and very cautiously come over and let me hold him. And I would hold him. And then maybe, the 3rd grade version of me would come out and slowly, cautiously approach me and then let me sit on my lap and let me put my arm around him. And then even the high school version, there'd be about 5 of us, 5 of, parts of me together, feeling like I was giving them the love and nurturing and celebration and attachment and security that they never had, which I didn't. I think it was very therapeutic, but it took me the longest time to understand this concept, which looking back, I don't know why, but it did. And I really enjoyed doing that. I still do it because it's therapeutic and it kind of brings things together, and it allows me to be in a position to do for my younger parts of myself that weren't done for me at the time.
It's a real integration of all, if you think about trauma hitting the split off self, the different parts of selves that we couldn't integrate and couldn't let be part of us. As Michael was speaking, he was showing us pictures of the different parts of the different ages that he went through, and to be able to integrate in your adult loving self is that with the mind that you start to understand from a compassionate place. It sounds like you were able to integrate all these different parts of you, and you continue to do it in the present. As these experiences come up, you have a way for yourself to nurture yourself. And I imagine that really gives you a sense of agency of these experiences that you're having.
And you use exactly the right word. In the integration, when you integrate 5 versions of yourself and you kind of integrate into your adult self, that's a more formidable, integrated person than the fractured previous version of you. So it's a much better place to be.
Michael talked about living a life over many, many years where he was terrified of intimacy, where he wasn't capable of having authentic relationships. And I think as he connected with all these different parts of himself that carried vulnerability, that carried his emotional needs, he, I think, has moved closer and closer to being at a place where he has now the capacity to engage with other human beings in a very, very different way, in a way where he can be open and vulnerable and authentic, where he does have needs. And I think he's in a place where relationships are very, very different for him than they've ever been before in his life.
You want to speak to that, Michael?
Well, it's true because I often tell people that previous version of myself, which I talked about earlier, I think people would meet that person and then I'd walk away or the conversation would end or whatever. And I'm convinced that they would have like, who was that? I don't feel like I got any real sense of who this person is. And I think that was pretty universally true because it was so on the surface, so superficial. And anything beyond that was just prohibitive, off limits. And when it came to intimacy with a woman, that was absolutely panic inducing. I mean, at one point, I had an experience with a woman who I had said goodnight to her in a house, and I went downstairs to my room. She was upstairs in her room. She came back down a little bit later in a nightgown, and I blacked out because it was just like the circuit breaker just blew because now here I am in the proximity of intimacy and just bam. So in that context or in that kind of situation, that's how extreme it was. And when I say panic inducing, I mean panic inducing to the point where blacking out was even possible. And I didn't know why, had no idea why. I said, I guess this is just the way I am. And getting to the bottom of that story, which was connected with one of the two nightmares I had for over 40 years, came towards the very end of my work with Dr. Magnavita. And back to the thing you mentioned earlier about, well, was this terrifying to you? I remember driving up in the 2.5-hour drive to his office during that period, but maybe close to the end, thinking, well, maybe this is so bad because I just had a feeling of dread and I didn't know why. Maybe whatever it is so bad, I can't handle it. I'm never going to know. And then, of course, that day was when I discovered, with his help, what that whole thing was, what the nightmare was connected to, what the panic was connected to, and it was about molestation and sexual abuse.
What was that like for you to be able, you're terrified, you're going into session, and then all of a sudden you're able to integrate all these pieces that didn't make sense to you?
At first, it's terrifying because I was aware of how afraid I was, but I didn't know of what. And at the same time, after the fact, realizing, okay, now I see how all this puzzle fits together. And it wasn't me. That wasn't this is a result of what had happened to me. And then there's a cycle of disbelief and sadness and anger. There's a whole bunch of things that come up because this was something that happened with my mother. And also it involved a pediatrician. There were separate incidents. So there's a whole cycle thing, but going into it, it's as if someone is holding you by the hair saying, open your eyes, you have to look, and you're scared to death to look. But then when you look, in air quotes, and you finally are able to face these things and understand what happened when you were 5 or 6 years old, that in and of itself is a sense of profound and absolute relief.
Oh, I imagine. So, Deborah, speak about that. Could you speak from a therapist perspective and being with somebody, as Michael's describing, going through this thing where all of a sudden the sudden insight hits him, something that he's blocked completely out of his memory, and now he's getting to a safe enough place in himself, a safe enough place with a therapist to be able to let this knowing in?
Well, I think so many of the folks that I have worked with over the years have spent a lifetime feeling alienated from themselves. They have felt like they're a bit crazy, right? They do things, they feel things, they don't know why they engage in certain patterns. They don't know why they're haunted by certain feelings or have certain symptoms. And I think as terrifying it is to enter that tunnel and keep going, again, therapists work hard to help clients to know that if they can keep their foot on the gas, if they can allow the support, and the holding as you go through the tunnel. They are going to come out the other side, and it's going to make sense. I say over and over to my clients, it always makes sense. By the time we get to the end of this journey, you're going to be able to connect the dots, and you're going to have an understanding. You're going to have a sight map for your life and your story, and you're going to be able to thread together, stitch together the pieces that have never made sense before. And I think that is really something to see people arrive at that place where they have a coherent narrative, where they have a story and there's an I. This is my story. I experienced this. This was my father or my mother or my babysitter, right? There's a sense of ownership, and out of that comes agency, comes a freedom to kind of move it into the past for the first time and re-engage with the present and the future in a new way.
And they don't have to make it make sense all by themselves. You know, like when you're saying, you're being able to say, it will make sense. You don't have to make it make sense. Be here with me. And as it unfolds, it will make sense. And we'll do it together and we'll integrate it together. I think that's such an important part of the process. Michael, you're nodding. Tell me a little bit about what.
Well, if I had $1 for every time Dr. Magdalena told me, don't try to figure it out. It'll all work itself out. It'll all come out. Just let it come. Just let it come.
And that's so different, isn't it, from being in an executive position where everybody's relying on you to go fix the problem and figure it out. And probably part of your defenses is always having the answer. So having to actually kick back into the unknown and be able to trust somebody else and just say, you'll figure it out. You don't have to do it. I imagine just that process of itself was probably a big relief and a big change for you.
Yeah. And also, I'll tell you what was another big change was, as it relates to trauma, and goes right to the body keeps a score. Bessel van der Kolk spoke about the somatic memory system. I would have, for the first time, physical experiences. I don't know what is going on. I mean, I remember one in particular where I was cramped and bent over, and I was in terrible pain. I don't know what is going on. And what was going on was my body remembering me being in a crib, not being fed. As a pre-verbal memory where no one's coming to feed me. And, if you're an infant, you're supposed to be, I don't know, I'm not a parent, but I think you're supposed to be fed on a fairly regular basis, and not being fed, no one coming to take care of me, just being abandoned. And so not only was the emotional component of that, but then realizing there's the physical component, like what is going on right now. That was another big part of the whole process of going up and through you and the release process.
The title of your book, Every Memory Deserves Respect, that really highlights for me the choice of the title for you.
So I'll tell you where that came from. I knew that no one would remember eye movement, desensitization, and reprocessing. So what if I came up with a set of words that were in context for a memory-based therapy that they will remember? And that's where it came from. And, it was great because the publisher, the first minute they got it in an email, they loved it. And it was never a discussion. So that's where Every Memory Deserves Respect came from. But, also, and Debbie has a great way of talking about the cover and the title.
Yeah, I was just going to say that, so many survivors of traumatic life experiences, adverse life experiences, are told either directly or indirectly by people in their lives to just get over it. Just put it in the past. It wasn't such a big deal. Why are you still dwelling on it? And, we really wanted to give the message that every memory deserves respect, that, if there's something about an experience that you've had that is haunting you in some way that you can't let go of, it deserves attention. And it's not for anyone else to say, you should be done with this, you should be over this, as if that were an easy step to take. That it's just critical that we make space to explore for what's still alive and kicking in your nervous system. And also, as I was saying, that by the end of treatment, many questions that clients come into therapy with get answered. We just wanted to emphasize that idea that if we trust the mind and the body to offer us what is unfinished, what is unprocessed, we are going to get to those answers that have been knocking around for a while, but, undecipherable. So again, this idea that if we trust that exploring the memories that are being held in the nervous system hold those answers, relief is going to be on its way. And on the cover of our book, we have a Russian, what do you call those dolls, Michael?
The dolls, the nesting dolls?
Nesting dolls.
Mm-hmm.
And the idea there is that, every person is a collection of experiences, a collection of memories, that get knit together into a life story, into a personality. And so the idea of there being many parts to every person and there being many parts to every memory, right? A memory isn't just the image of what happened, right? People often think that memory is simply the image, being able to remember the details. But memory involves the feelings that were experienced at the time, the experience of the body in the course of a traumatic experience, the beliefs, the words, the different sensory aspects. And so this idea of a nesting doll also captures that idea that what we're doing in EMDR is we're bringing together all the fragments of memory to be able to assimilate them, to integrate them, and to make meaning out of what has happened in one's life.
And Michael's experience of the physical manifestations of the neglect, that was not a memory. That was not a memory that we would think of in traditional ways of, I cannot remember of laying in my crib and being neglected. But your body remembered. The Body Keeps the Score is one of the most perfect titles, I think, of many books. But like your body was holding that. It was holding that layer of memory that then, as you're saying, got unfolded and unfolded in all the different layers over the period of treatment.
One of the strengths of EMDR is that it's superb at accessing implicit memory. Memory where there may not be words, memory that's held in the body, memory that's held as an impulse, memory that's held as a felt sense. We just have clients focus on it, just notice that. And from that experience, there often emerges a clearer sense of what has been haunting that person, what has been affecting the person from underground over time.
So, Debbie, could you speak to two things that I'm thinking as a listener out there? What are some signs of trauma that aren't as much as obvious? We have the traditional signs of PTSD, of the reliving, but there are so many different signs that trauma's there that as therapists or as individuals out there, we might miss. Could you talk a little bit about that? And then I'd like you to walk through, as an EMDR therapist, from your perspective, how do you describe EMDR to your clients? What is it?
First of all, trauma creates dysregulation at many different levels, right? So it creates dysregulation at a body level. Folks that have experienced trauma have all different kinds of somatic difficulties. All systems of the body get affected. We know a lot from the ACE study about all the ways that people who have early childhood traumatic experiences struggle at a somatic, at a medical level. So those symptoms, the stomach aches, the headaches, the breathing difficulties may not get recognized as trauma, but in fact, they often are. It's the body keeping the score, as Bessel van der Kolk talks about. So we talk about dysregulation at a somatic level. We talk about dysregulation at an emotional level, where folks find themselves feeling sad and they have no idea why, feeling scared and they have no idea why. So it's one thing if you're having a flashback or you're having a nightmare and you feel scared and you say, oh, I'm feeling scared, or I'm feeling sad, or I'm feeling powerless because my traumatic memory has been triggered. But sometimes people have those experiences emerging out of nowhere. They don't know, they don't understand what the trigger has been. They don't understand that it's connected to memory. I think that was Michael's case. Michael had these phobias, these anxieties, these reactions, these avoidances, and he just thought it was who he was. He did not have any sense that it was connected to trauma. So we've got somatic dysregulation and emotional dysregulation, folks that get triggered into rages, highway, rage, and have no idea where that's coming from or why that's coming up. We have clients who experience dissociation. They have concentration difficulties. They have difficulties with memory. They are unable to make sense out of things that other people around them may be able to track or follow. And that may reflect early trauma as well. So, these are some of the symptoms, some of the difficulties that we see across the board that might not get picked up as PTSD per se or trauma-related per se.
How would you describe, from a client's perspective, how do you describe what EMDR is? What does it stand for, and what exactly is EMDR?
So first of all, EMDR stands for eye movement desensitization and reprocessing. Just to break that down, desensitization refers to the reduction of distress, fear, and anxiety. Reprocessing refers to the reevaluation or the restructuring of thoughts and beliefs and the transformation of one's sense of self relative to past traumatic experiences. It's about moving the past into the past. And then there's the eye movement part. Now, Francine Shapiro, the developer of EMDR, accidentally discovered that purposely moving your eyes horizontally back and forth while focusing on a traumatic memory leads to a reduction in the vividness and the emotional intensity of the memory. She developed this effective protocol for treating PTSD and trauma-related problems using this bilateral stimulation, this back and forth eye movement stimulation. And she published the first research study in 1989, hence the name eye movement desensitization and reprocessing. And EMDR is a memory-focused psychotherapy that helps people deal with the impact and the legacy of trauma and adverse experiences in their lives. And it's based on the idea that psychological problems are related to a failure to adequately process traumatic experiences or memories. And so these unprocessed memories, frozen or locked in the nervous system, continue to affect how we perceive things, decisions we make, reactions we have, the beliefs we hold about ourselves and others. And then present-day triggers activate these unprocessed traumatic memories, leading symptoms that cause ongoing distress. So in EMDR therapy, we help clients to access and activate their unprocessed traumatic memories with a set of focused questions. And then we jumpstart the brain's information processing system using bilateral stimulation. And with EMDR reprocessing, the client's distress eventually decreases and relative adaptive bits of information located in other parts of the brain, adult insights, adult perspectives, helpful present-day perspectives get integrated. So the idea of it's over, I'm safe now, I was only a kid doing the best that I can do, I have control now, I have choices now. This information starts to naturally get integrated once we begin the processing with bilateral stimulation. And there are shifts in thoughts, in feelings, behaviors, physical sensations. Healing involves spontaneous movement toward more positive thinking, toward more manageable feelings, and a significant reduction in the level of distress held in the body.
Michael, what was that kind of bilateral stimulation experience for you? And what was it like to sit in the client's seat through this process?
First part was how did I react to Debbie's answer? And I was distilled to one of the things that she just said, which was so fundamental, which is the belief that psychological problems are the result of unprocessed traumatic experiences or memories. Full stop. EMDR therapy is designed to reprocess those traumatic memories once and for all, put the past in the past, and give the client the opportunity to reevaluate those memories with an adult's perspective, not a child's perspective, so that you can integrate and move on. For me, the bilateral, I had never done it before. It was surprising to me how quickly that part of the process, because EMDR has 8 phases. People tend to want to focus on the bilateral part, but there's 8 phases of EMDR, all comprise collectively EMDR therapy. But for me, what was surprising is how quickly, and I'll use a word that Debbie just used, it jump-started the process for me, almost like wormholing back and then, ripping the cover off of things, and so that these experiences were coming out, up and through me that I had never had happen before. So it was surprising, incredibly effective, and left me with profound relief every time. Whereas in contrast, I saw one talk therapist in New York, and again, I have to be careful. This is just my experience. I was seeing a talk therapist. This is before, I met Dr. Magdalena, and I would leave there after my 50-minute weekly visit, thinking, where is this going? How is this going to help? I don't feel like I'm going anywhere. I feel like I'm like treading water, and before I know it, 50 minutes and we're done, and you come back next week. This is like trying to, do a root canal with a coffee stirrer. This is not going anywhere. Try clearing the snow off the driveway with a spoon. I want the snow blower. So at one point I said, I'm not doing this anymore because this is just not going. This is not getting me anywhere. Well, starting with the first session with Dr. Magdalena, boy, did we get places that I didn't even know I had any way to get to in the first place.
Yeah, it wasn't like you were going into these talk sessions in a resistant way. You were hungry to find some difference and to find some answers and to just get lost in that process. And then all of a sudden to feel the relief as the memories start to come and the integration starts to happen. And again, to emphasize the integration with your adult self.
Also, Debbie mentioned something else I want to make earlier for other people who maybe can relate to this. I was so disconnected as a kid. I was what my mother referred to as an accident-prone kid. So I had, you probably don't know if you can see it, but I had like maybe 6 concussions, always here. So I couldn't read for the longest time. I would go to regular school, and I had to go to special reading school because I couldn't read, because it was just, I couldn't focus. I was just dissociating. And then even in college, I would start a paragraph, go to the library, start a paragraph, start over, start the paragraph, go somewhere else, start over. And, it was incredibly difficult for me to try to deal with this phenomenon where my brain was just going all over the place all the time. And that's one of the, unfortunately, side effects of unresolved trauma in my case. You can't focus, you're not aligned, there's no sense of inner peace or calm. It's anything but.
And then in many cases that gets seen as, which it may be, but it gets seen as a learning disorder or behavioral issues, right?
Absolutely. A terrible standardized test taker, struggling in school always. My brother, by contrast, he wouldn't do anything. He got straight A's. He didn't do I don't think he ever opened a book. And I think as a kid, they would have said, well, he's an ADHD kid. Well, it wasn't, so oftentimes trauma in kids, well, I'll let Debbie speak to it, but it was a very hard way to try to live. And I remember when I sought out my first therapist in Boston, he said, why are you here? I said, well, I'm having a hard time concentrating. This is what I told him. This is why I said I was there. And I'm sure if that person was Debbie, okay, close the door. Yeah, let's get started. Yeah.
Let's drop in that in a whole different way than what's distracting you.
Yeah, let's see what this I can't concentrate really is all about.
Debbie, do you have any thoughts about that?
No, I think Michael's right. You asked about presentations that aren't necessarily recognized as trauma-related or not the classic PTSD symptoms. And, we do know that problems with concentration is part of PTSD, but very often when it's the single thing that somebody comes in reporting or one of a couple things, and somebody is not trauma-informed, they don't begin to connect the dots. They don't begin that process of exploring, when did you start having difficulty concentrating? Was there a time before when you were able to concentrate? And what was happening in your life around the time that you started having trouble concentrating? What's wonderful about Michael's story is that he's an avid reader now. He couldn't read as a child. He had reading tutors, as he said, and Michael reads nonstop now. So, his brain has been healed, so to speak.
My current book is Strength in Stillness, and it's about meditation. So I just finished my 4-day course on transcendental meditation, which is my newest thing, which I'm really excited about. But, talk about coming full, going the other side of the planet, because it's all about stillness, letting your mind and your brain calm down. And my brother's done it for over 20 years. My older sister has done TM for a long, long time. I said, I'm finally going to do this. I'm really excited by the possibilities, and I'm really excited to, on our last day, we got this book. It's the CEO of the David Lynch Foundation, which he's a big TM advocate, the director. So I'm eager to read it.
So tell us a little bit about what you see differently for you after doing all of this work that you've done in your professional world, because a lot of times people are a little scared that such a big change is going to interrupt them from all of their professional successes.
So you're describing that people are afraid that they're Samson and she cut your hair and you have no powers. In my case, quite the opposite. And so I have my own consulting practice. And if anything, it has made my efficiency much greater, the quality of my work much higher, the confidence that I have in doing the work, which never really was there before, because as I said before, that this house of cards that was the grandiosity thing, there's no foundation for that. Now it's based in an authentic self foundation. I know I have these skills. I know my clients value them and they pay me for them. And as far as my life goes, I'll give you the most profound example I can think of, which is the fact that my brother, who was my bully at home right up until I graduated from high school, and then I went to school as a boy and had a bully in school as well. And anybody who's listening who knows anything about bullying, you live in a state of terror all the time. You never, ever, ever feel safe. Anytime you can turn around, there's Derek Parmenter slugging me in the stomach in third grade in the lunch line. All of a sudden, I black out. I look up and a circle of faces are looking down at me as I'm lying on the floor. And then there's the humiliation component to being a victim of bullies. So my brother was my bully at home. We had no relationship our entire lives, and I was convinced I would never have a relationship with him. Right before the book came out, Dr. Magdalena study, I had to let him know it was coming. I couldn't spring it on him, for a lot of reasons, not the least of which was a legal possible exposure. He could do some, who knows what. So I reached out to him, and as Debbie says, he reached back. He said, you can say whatever you want about me, just the idea that after 60 plus years, we might have a chance to have a relationship as brothers would bring me complete joy and happiness. And we took a trip together recently, this last summer, for the first time in our lives. The Monday of that week was my brother's 70th birthday. So that's how long it took. We've had a Zoom call, but I have to add into this story. When I reached out to him and he reached back, he asked me if Debbie could recommend an EMDR therapist for him. So he had an EMDR therapist, an incredible transformative experience. And that's what allowed this to happen. If it had just been me, would have been possible. It's because we both did it. So the person I see now was not the person I grew up with. So that first week we spent together in our lives, that Monday of that week was his 70th birthday. That's how long it took. And the fact that I had a two-year EMDR journey with Dr. Magdalena, he had an EMDR journey with a colleague of Debbie's. He also, by the way, for your listeners, he writes about EMDR in terms of how he experienced it in the most beautiful, amazing. Debbie is always blown away by these pieces. On our website, you can click at the bottom of my author page. It says, click here for my brother. You can read some of his stories. They're incredible.
And I am so appreciative for our audience that you were talking about the effect of bullying, because I think, especially for men, that is, for all, it's horrendous. I think men are taught so much that that's just part of life. That's just part of being a boy. Boys will be boys. And it is a very traumatic impact. And often people dismiss that so often.
And I think there are so many men who have been bullied as boys who don't want to say a word about it to anybody. I think it's way more common than we think or know.
I completely agree. And the impact, and you being courageous to be out there rating this book, talking about your own personal traumas, both sexual and bully and neglect, and being able to say, this is what I have gone through. This is what's made the difference. I think it's very, very inspiring. So I was excited to have you on the show talking about it, because it can free other people up, especially men out there who believe that past should be past and we should just move it on and it's not affecting me now because look how successful I am. And yet divorce after divorce or unhappy relationships are present, and the healing and the aliveness that can come from actually dealing with your own trauma. And so you're an inspiration out there. So
thank you. Well, I just felt that if I was honest about my story, other people might be more comfortable telling their own, starting with telling it themselves. And in particular, men who, as you say, and Debbie knows, I think are conditioned to not be vulnerable because that's a sign of weakness. And you don't want to go there. You just don't do it. You know, it's a funny, in 2023, we still have this phenomenon, but I think it's true. So I felt if people, could read mine, say, well, geez, matter of fact, I had a XYZ and this had, great. By the way, I should tell you, again, for your listeners, I'm now up to 54 people who, since I started this book project and the book came out, have asked me for recommendations for EMDR therapists that Debbie has provided. One has saw a talk therapist for 10 years and finally cut the cord and is having an unbelievable experience with EMDR therapists. So I'm up to 54 people.
That's amazing. Debbie, before we end, I want to come back to, and I will come back to for the listeners out there that are probably thinking, but how do I find EMDR therapist? Because not everybody can call Debbie. But so I'm wanting that question. We will end with that question. But it crossed my mind something that I feel like we'd be remiss if we don't tap on, and it's a passion of yours, Debbie. So I want to bring that in, and that is, as we're describing the pressures of culture on men and the suppression, we would be remiss not to talk about the trauma effect of the institutionalized racism out there, of homophobia, the impact of some religious institutions that create fear and lack of acceptance, and how individuals out there not given a voice. It's not even that they can't take it, not given the voice, and yet having the trauma experience of not having choices in their lives and being oppressed, and that is and does have a traumatic effect on the body for the individuals, for the families, for the culture, and for generations. And I know that's a passion of yours, and I would love to hear your thoughts about that and how it relates to trauma.
Yeah. Thank you for asking about that. Racism, sexism, homophobia, other injustices affect identity and sense of worth, self-esteem, right? They affect one's sense of safety and danger in the world. They affect one's sense of power and control. They affect one's sense of connectedness and belonging or alienation. And marginalized individuals and groups often experience fear and hypervigilance, headaches, body somatic symptoms, self-blame, confusion, shame and guilt, sense of powerlessness. And we look at all of these symptoms, we look at all of these domains in EMDR therapy. With my clients, I always ask about experiences of feeling different, ignored, or invisible related to race, sex, gender, religion, culture. And I inquire about the kinds of messages that they've received that have left them feeling alienated or inferior. And in that EMDR kind of way, we explore for experiences of being misjudged, misunderstood, held back, harmed, physically or verbally assaulted because of their identity, because of their race or their culture. It's also really critical to inquire about whether there have been opportunities aimed at validation or repair or rectifying the wrongs, because again, in EMDR, we want to try to give opportunities for redoing. So we explore what didn't happen that needed to happen. And often folks are able to explore that in EMDR processing, and then out of that experience, they're able to go out into the world and fight for what they need, fight for that recognition, get engaged in activism or whatever the case may be. But, many people from marginalized groups have had to hide aspects of their identity, their culture, their race. And as you said, many have come to recognize how trauma-based beliefs and feelings and behavior patterns have been carried from one generation to the next. So I'll end my answer by saying that, in EMDR, we focus not only on what happened, but what didn't happen. We focus on commission and omission. We focus on macroaggressions, the really obvious experiences and subtle microaggressions. And we make room. We make room for grieving and anger, for fantasies of revenge, for impulses related to fighting back or speaking up. And through processing of their traumatic memories, people from non-dominant, marginalized groups come to appreciate their resilience and their survivorship. They find their voices. They're able to imagine saying or doing what they couldn't do before.
Probably what they still can't, but at least they're in your office. I would just imagine being able to have this kind of an experience and talk about it in the present, the redo in your office.
Yes. And I was just going to say that one of my favorite questions as of late in the midst of processing is to ask, what would justice look like? When you imagine what you need, what hasn't happened, what needs to happen for you and in our society, what does it look like? And we continue to process through that. And again, that's part of what helps people arrive at a place where they have a voice, where they have clarity about what's needed, and they can begin to move toward action, toward activism.
And moving it away from them into the outside world where it belongs, right? Moving it from they're locked and holding.
What they've internalized has to be externalized. Exactly.
Well, I could talk to you for a whole nother hour about that topic, and maybe at some point we will. I really, really appreciate both of you coming on Therapists Uncensored and sharing this wonderful book. I will be in our show notes, so for anyone that wants to track it down. And Michael, I'll start with you. You mentioned that you have a website. How would people find you if they were interested in talking to you?
We try to keep it simple. The website is everymemorydeservesrespect.com. And you can find a therapist. There's many videos. There's resources from Debbie. We try to be as comprehensive as we could, and we work on it on a fairly regular basis. So I would direct everyone to everymemorydeservesrespect.com. And if Amazon is your book vendor of choice, obviously we're there, and many other places.
Thank you. And again, that will be in our show notes. And that was a question for you, Debbie. And we've already partly answered it. If someone out there is very interested in finding an EMDR therapist, they can't all call you for a referral.
Please don't all call me.
How might somebody track down somebody's EMDR and know that it's right for them? What would you recommend?
First of all, there are links on our website which will take you directly to the EMDR International Association, emdria.org. That is the international membership organization for EMDR therapists. And there's a Find a Therapist directory there, and people can plug in what they're looking for. They can find therapists in their area. And there's different levels of credentialing. There's the highest level is consultant, and then a certified therapist, and then everybody else. So they can explore based on people's profiles who would be right for them. And they can email EMDR therapists directly through that site.
By the way, I should add, in the book, there's a whole section on how to find a therapist, the questions you should ask when you're looking for a therapist. We thought that would be valuable for people.
That's awesome. And I really want to emphasize that Deborah Korn is one of the renowned experts out there in EMDR. So we are very honored for you to be on our program and talking about it. And if somebody wanted to get a hold of you, not for referral, is there a place to find you, or is that website also?
That website is the best place to get to me.
To get in some contact.
Or through the EMDRIA website as well. People can reach me, emdria.org.
Thank you both so much. And thank you all for joining us today. If something that you heard today from our guest feels helpful and moving to you, please pass it on so somebody else can grow. And take some time to rate and review us. That always helps other people find us. Thanks so much for joining us, and I'll see you around the bend.
Therapist Uncensored is Ann Kelly and Sue Marriott. This podcast is edited by Jack Anderson.